Welcome to Easy Anatomy, and now we move to intercostal nerves. What are intercostal nerves? Where they come from? Where they come from? Intercostal nerves, those are thoracic spinal nerves. Okay? It means we have T1 down to T12. T12 we call it subcostal, and up to 11 we call them intercostal because they travel through the intercostal space. Okay, we divide them into typical and atypical and atypical. The typical intercostal nerves are limited to intercostal spaces, supply muscles and the skin of intercostal spaces. However, atypical either extend, in addition to intercostal spaces, extend to upper extremity or abdominal wall. Okay, the typical nerves are from T3 to T6, the thoracic nerve number 3 to 6. The one which supply also upper extremity are T1 and T2. The one supplying abdominal wall from T7 down to 12. Down to 12. Okay? So those are the thoracic or the intercostal nerve. They start from spinal cord, exactly from the thoracic segment of spinal cord. So here is the spinal cord, and again this, the dorsal root, ventral root, they join each other, they form the trunk, correct? Then the trunk is going to split into posterior or dorsal ramus and the ventral ramus. Okay, so this is the dorsal root, which is sensory. This is the ventral root, which is motor. This is the trunk of the spinal nerve. Then this is dorsal ramus, and this is ventral ramus. Okay, so what does this mean? Does the ventral ramus continue anteriorly until it reaches? Here is the sternum. Where it ends up as anterior cutaneous nerve. Anterior cutaneous nerve. Okay, so what does this mean? It means that the intercostal nerve, is it the dorsal ramus or ventral ramus? This is the ventral ramus of thoracic nerve. So when I come to this one, I see that intercostal nerves are ventral rami of thoracic nerves, thoracic spinal nerves. Okay? So how they travel through the space? Here is the rib, costal cartilage, again. Here is the costal cartilage, and here is the rib, costal cartilage. So this ventral ramus travel between the innermost muscle and the internal intercostal muscle. Internal intercostal muscle. And then anteriorly here is going to penetrate the anterior membrane and end up as anterior cutaneous branch. In the middle here, at the lateral side of the space, send this lateral cutaneous branch, which divide into anterior and posterior. So this is lateral cutaneous branch. This is the anterior cutaneous branch of intercostal nerve. In the middle here, start to send muscular branches. Muscular branch. Here, close to the vertebral column, remember we have sympathetic chain, sympathetic trunk. Okay, this sympathetic trunk and the sympathetic ganglia, sympathetic chain and the ganglia. You will see that this spinal nerve, this ventral ramus, will send this white ramus and the postganglionic fibers come back and join the nerve back again and continue with it. Okay, this what we call it, the preganglionic fiber, we call it white ramus. The postganglionic fiber, we call it gray ramus. Those are ganglionic branches coming from the intercostal nerve. So if I ask you what are branches of the intercostal nerves, branches of the intercostal nerves, first you have communicant with sympathetic. What is the function of this postganglionic fiber? The postganglionic fibers are vasomotor, are going to supply the blood vessels in the intercostal space and leads to vasoconstriction. So this is going to supply, this postganglionic fiber are supplying blood vessels. Second, you have this lateral cutaneous to supply the skin over the lateral side of the chest wall. Okay. Then 3, you have anterior cutaneous supplying skin over the front of the chest wall, skin of the anterior part of the chest wall. This is for the skin of the lateral side and the back. 4, muscular branches supplying intercostal muscles. Okay. So those are the most important branches coming from the intercostal nerves. Ganglionic branches, the white ramus and the gray ramus, communication with the sympathetic trunk. Then you have muscular to the intercostal muscles, lateral cutaneous, anterior cutaneous branches. How about number 1 and 2? T1 and T2. T1 is part of brachial plexus, correct? Remember brachial plexus, how it is formed? You have C5 and 6 form upper trunk, C7 continue as middle trunk, and C8 and the T1 form the lower trunk. So T1 is not only limited to the intercostal space but also contribute to brachial plexus. Number 2, send the cutaneous branch to the medial aspect of the arm called the intercostal brachial nerve. Intercostal brachial nerve. And this is the reason why in heart attack, chest pain refer to the arm, to the medial side of the arm, because of this number 2, which supplying the heart tissue and also supplying medial aspect of the medial aspect of the arm. This one supplying chest wall and also medial aspect of the arm. That's why, again, ischemic heart disease or heart attack, usually the pain is not limited to the chest wall but also refer to the medial aspect of the arm. T7 down to T12, those are nerves supplying both intercostal spaces plus abdominal wall. Okay, and if you take umbilicus as your landmark, umbilicus, you will see that the skin around the umbilicus supplied by T10, and below the umbilicus down up to T12. Above the umbilicus extend above up to costal margin, you might have T6. Okay, so this is how thoracic nerves or intercostal nerves, only T3 to T6, they are limited to the intercostal space. However, T1 and T2 are going to supply the arm and the upper extremity. T7, T12 are going to abdominal wall. That's why we call them atypical nerves. Okay. Okay. If you want to insert a chest tube, or you want to do simple surgery in the intercostal space, you need to block intercostal nerves. Okay, and I forgot to tell you, one of the branches of the intercostal nerve, something is called the collateral branch, and this collateral branch, remember that where is the intercostal nerve located is traveling through the costal groove, which is located as the lower border of the rib. So you have costal groove, this is costal groove, this is the rib, and in this area this is the costal groove. You have vein first, then artery, then nerve, then the intercostal nerve, the intercostal vein in the costal groove, which located in the lower border of the rib, lower border of rib. It means upper part of the space, because if I say this is the rib blue and this one is the intercostal space. Okay, so keep in mind that this nerve send collateral branch to the lower part of the space. Collateral branch to the lower part of the space. Collateral branch. That's why if you wanted to do nerve block, you need to make sure that you can target both nerves, this one and that one, and preferable not to go to the close to the costal groove, not to hurt the blood vessels. If you want to insert needle, okay, it's much better to be towards the lower part of the space, here, to avoid injury of the blood vessels. Okay, so again, the branches, we said we have communicating branches with the sympathetic ganglia, the white ramus and the gray ramus, which are pre and postganglionic. We have collateral branch go to the lower part of the space and contribute to nerve supply of the muscles. Then you have two cutaneous, the lateral and the anterior. Thank you.